conditions. And so there's a whole variety of what we call equivalents of TMS that aren't just musculoskeletal type situations, but stomach and stomach problems like irritable bowel syndrome, GERD, non-ulcer dyspepsia. I had a lady the other day, a few months ago now, who had severe stomach pain for 13 years. It was occurring particularly in the fall of the year. And she started, after a while, being unable to work. She started having panic attacks around 4 in the afternoon. Very smart, nice lady, in the medical profession. She came to see me. We talked. It turned out that in the fall of the year, before she started having this pain, her husband, her second husband, had died. And she had had to withdraw treatment from him, pull the plug, so to speak. She grew up Catholic. She felt that was in conflict with her religion, and she had a tremendous amount of guilt about that. She never grieved about it. She quickly got married to another man who was nice enough, but in the fall of the year, he had to go back to work because he's a school teacher and a high school band director, so he was relatively unavailable. And every fall, her pain got worse and worse and worse, and now it's year-round. She came to the class, realized the connection, realized what was causing her illness. She had seen 3 different gastroenterologists. She'd already had her gallbladder taken out. None of that helped. And so she came to the class. She went back and looked at her husband's death certificate because she felt it was related to that. What time do you think he died? 4 o'clock in the afternoon, the time she's having these panic attacks. She put it all together, did some of the work that you're going to be doing. Her pain went away, her panic attacks went away. So it's very powerful, this stuff. A lot of CNS, central nervous system type stuff. A lot of people with dizziness. I've seen a lot of people with ringing in the ears. A lot of people with BPV, or benign positional vertigo. Chronic fatigue, trouble sleeping. We see a lot of that. And a lot of times these will coexist with a lot of the other disorders that we have. When I say we, I'm including myself. I talked already about interstitial cystitis, some sexual dysfunctions, well known that these can be related to stress and mind issues, and a variety of other things. I had a really amazing incident happen here with one of the guys who works at the hospital. He came to a lecture like this. He read Dr. Sarno's book. He realized that his chest pain was due to the stress in his life. Because every time he started getting his chest pain, someone had just called him and yelled at him or chewed him out. And as soon as he made that connection, his chest pain went away. And then, a couple weeks later, he noticed that his allergies had cleared up. Now, that was a surprise to me. I was like, wait a minute, how did this happen? Because he'd been on allergy shots and allergy medicine and all this stuff. His allergies cleared up. He was able to walk in the garden and weed and do all this kind of stuff. And so that was amazing. So he wrote that up for me. And then a couple weeks later I saw him. And he told me this story that was very instructive. He told me that he had gone out with another couple, and they had gone home to his house after the movie. His wife and his friend's wife were in the kitchen making some coffee, and he was in the living room talking to this friend of his. And this friend starts telling him how he's depressed, how he's on medication, how he's kind of suicidal. And all of a sudden, the guy that I know now, his eyes start watering, his nose starts running, and he starts coughing. An allergic reaction, right? His allergic reaction. And he doesn't know what's happening, but he excuses himself and he goes to the bathroom. And he's in the bathroom and he's blowing his nose and stuff. And this thought comes into his mind, wow, that got me out of there. And then he realized, that got me out of there. I was so uncomfortable hearing my friend tell me about the depression and the medication and the suicide that I didn't even realize how uncomfortable I was. But my body had the physical reaction to that. And it got me out of there. And I left. And as soon as he realized what it was, his coughing and the sneezing and the nose running went away. And a couple days later, he was having a discussion with his wife about finances. He says, every time we talk about finances, it's stressful. And his nose started running, his eyes started watering, he started coughing again. And then again, he going, oh, wow, I guess this is my reaction. And it went away. Very amazing, very how powerful the body can be in understanding how we're feeling. And so this is the physiology, the way Dr. Sarno describes it. Tension in the mind, and particularly in the unconscious mind, where we may not even be aware of it. Leads to activation of the autonomic nervous system, which is in the hypothalamus in the brain. Leads to narrowing of blood vessels temporarily, decreased blood flow, spasm of blood vessels, spasm of muscles, smooth muscles, spasm which can cause pain, diarrhea, constipation, which can cause the bladder type symptoms we talked about, that can cause all the muscle symptoms that we talked about. And that's the result. And so that's how it occurs. There's research evidence that shows that in people with chronic pain syndromes, there's vasoconstriction. There's decreased blood flow to muscles. And in this study here, they put little catheters in the trapezius muscle in people with chronic tension headaches and people without chronic tension headaches. And they found difference in the blood flow, in the muscle, in people with chronic tension headaches. This is another similar study where they looked at muscle tenderness. Even when people weren't having the headache at the time, they showed increased tension in their bodies. And when I examine people who come to my office, I frequently find pain and tension in the muscles of people's bodies, even in parts that aren't hurting at the time. Because we're storing tension in our bodies by living life. And people who have TMS, like I do, like most people do, in fact, we'll get to that in a minute, store tension in their bodies.